Everyone, I'm Dr. Bhavya Jha, Fellow in Reproductive Medicine at the International Fertility Center. Today, I'm going to talk about when to decide when we have to draw a line between IUI and IVF, when to switch from IUI to IVF. IUI is a procedure called intrauterine insemination, which is done in infertile couples, usually with oligozoospermia. Their sperm count is less than 50%. In those patients where we have PCOS or any kind of unexplained infertility in grade 1 and 2 endometriosis, or if they have anovulatory cycles, then usually we do IUI for them. But many a times, even after doing IUI for 2, 3, 4 cycles, we seem not to get a clinical pregnancy, and the patient starts getting frustrated. Of course, their hopes rise and then they fall again. So we have to decide on when we have to switch to an IVF cycle. So usually for sperm count, we usually draw a line of 15 million for doing an IUI. So if it is more than 15 million, we decide on an IUI. The morphology should be more than 4% and the motility count should be more than 40%. If it is lower than that, we should explain the patients and plan an IVF for them. And apart from that, another important factor is the ovarian reserve. So if AMH is extremely low, then it's better to switch to IVF cycle. Very low meaning less than 1 picogram per ml. That is the AMH count, anti-Mullerian hormone count. If it is lower than that, we even look at the antral follicular count. If it is very low, then we do plan IVF cycle for them. But if it's average, between 2 to 4 maybe, then, and if it's an ovulatory cycle, then of course we plan IUI for them. We stimulate their ovaries, and then once the rupture injection is given, IUI is planned in the IVF lab. But again, if they're not getting clinical pregnancy with 3 to 4 cycles of IUI, we do plan an IVF for them. So similarly, what happens exactly with IUI cycles is there is a lot of stress. All over the world, it is the success rate of IUI is around 15 to 20%, but IVF cycle goes up to 50 to 55%. So the switching to IVF depends a lot on the center, the kind of patients, the socio-economic status of the patient. There are patients who cannot afford IVF at all, so we do cycles up to 6 IUI cycles for them. And switching on to IVF is not possible for such patients. So it totally depends on the factors, the male factors, the female factors, the kind of setup, the kind of patients, and the doctor has to decide according to that. It is usually seen that after, according to ESHRE, after 3 cycles, if we have not achieved pregnancy with IUI, the success rate starts declining after 3 cycles. Though in the books they do say that we can try up to 6 cycles, but at our center with 3 to 4 cycles in any of the patients with unexplained infertility, with endometriosis, with PCOS, or any kind of anovulatory problems, with intact tubes, that is tubal patencies checked first, we do not attempt more than 4 cycles. And we do switch over to IVF, and so that the mental stress of the patient is controlled and they get a better success rate with IVF pregnancy. Thank you.